Has a regular birth control or contraceptive pill seriously disrupted your menstrual cycle? Watch this video to learn about the different reasons you may have irregular bleeding when you're taking the regular birth control or contraceptive pill method. Hi everybody, welcome to the channel. I'm Dr. Sylvia. This is Askawayhealth. Subscribe to the channel and don't forget to click the notification bell so that every time I publish a new video, which is once a week on Saturdays, you'll be the first to know about it. Now, when you're taking the regular contraceptive pill or birth control pill, you need to realize that the effect of the pill is to suppress your natural sex hormones, that is the estrogen and progesterone in your body. Most of the birth control pills that we use today contain either one or a combination of these two sex hormones or another different type of medication. I'm going to limit our discussion today mainly to the effects from the birth control pills, which contain synthetic forms of the sex hormones that our body produces, estrogen and progesterone. If you're taking the combined pill, which is a combination of an estrogen and a progestogen, you may have your pill every day for 21 days, and then for a 7-day period you have either a placebo or a pill that contains iron. You're not taking the active hormone during that period. You expect what's called a withdrawal bleed. That bleed is not your normal period, but it's simply an effect of the reduction or brief withdrawal of those hormones during that short period of time that causes the lining of your womb to shed. For women who take the other type of pill where you have just one hormone, the progestogen, called the mini pill or the progesterone only pill, they may not even experience a bleed. So the expected outcome when you're using most of these pills is that you have a brief withdrawal period that is designed to give you a sense of normalcy so that every month you have a bleed and it seems like a regular period. So what do we mean by abnormal bleeding or irregular bleeding on the pill? Well, most of the time you will hear these terms: unscheduled bleeding, breakthrough bleeding. They're generally referring to any kind of bleeding that is not expected, so it is not the withdrawal bleed, and it's happening in a completely unusual fashion to what you expect when you're taking the birth control pill. So what kind of abnormal bleeding could you experience? Now don't forget, we've said that some women, particularly those who are using the mini pill, might not even experience any bleeding at all. But for those who experience these breakthrough or unscheduled bleedings, they might have a prolonged bleeding after the withdrawal. So that means that they could have bleeding that goes on for up to 14 days or 2 weeks after that withdrawal bleed. They may also experience a very heavy amount of blood loss. It might be spotting, having episodes where it's not predictable. Spotting just happens at random periods during the month, or spotting just carries on happening every day, or even heavier episodes of bleeding that might happen in between one withdrawal bleed to another. There could be bleeding after sex, or some women simply complain of bleeding every single day. It doesn't stop, it's just continuous. So what can be responsible for these problems? First, when it comes to abnormal bleeding, we should remember that the type or the method of birth control matters. Now, some studies compared women using the contraceptive vaginal ring to the contraceptive combined hormone pill. The combined hormone pill contains estrogen and a progestogen. This is exactly the same combination in terms of hormone type and dose that is found in the contraceptive vaginal ring. What they found is quite interesting, that women who use the contraceptive vaginal ring are less likely to bleed than women who are on the contraceptive combined pill. And we think the reason for this is because women who are using the ring have the hormone being released in a constant, regular, consistent fashion compared to women who are taking the pill, where they have to swallow the tablet, it's got to be digested and then absorbed into the system before it can start to work. Okay, for reason number 2, the thing to remember is that the different birth control pills have different quantities and types of hormones, even amongst combined pills and amongst mini pills. for instance, with the combined pill, you can have an estrogen that is less in concentration in a particular pill compared to another. The reason for this is because the manufacturers are trying to produce pills that have more desirable or less adverse effects and are more tolerable for people. So you may have a pill that has a lower concentration of estrogen compared to another combined pill. Similarly, you could have a combined pill that has a different type of progestogen to the next combined pill. Now, what we found in studies is that women who take a pill combination that has a lower dose of estrogen tend to experience more bleeding than those who have combined pills with a higher dose of or concentration of the estrogen. They've also noticed that when a woman is taking a pill that has a progestogen that is older, they tend to have worse bleeding. Reason number 3, your body makeup is important. The way our bodies, individual women's bodies, take up these hormones after we've swallowed them, digested them, and absorbed them differ from one woman to the next. So what we found is that amongst women taking this exact same pill, some women may have blood levels of the hormone that are 10 times more or 10 times less compared to other women. So with this kind of big variation, even amongst women taking the same pill, you can understand why some women might experience bleeding or irregular bleeding pattern on that same pill, which another woman might not. Okay, so let's move along. Looking at other reasons why a woman could experience an irregular bleeding pattern on her pill, let's look at the effect of the pill on the vagina and the cervix. Women using the combined pill might experience dryness in the vagina, which can sometimes lead to bleeding problems. The pill can also cause a condition called cervical erosion. Cervical erosion simply means that the nature of the tissue that you find within the outer part of the cervix that is sitting outside in the vagina has changed to resemble or to be like the tissue that you find in the inner part of the cervix inside within the womb. The thing about this is that the inner lining tends to be softer and the color appears more red. It's also more likely to bleed with the friction that happens during sexual intercourse. The pill is more likely to cause women to have cervical erosion, although some women could also have that when they are pregnant. So having cervical erosion is one reason a woman can experience bleeding after sexual intercourse, and simply being on the pill could be responsible for this. Another reason it's really important to talk about any episodes of bleeding after intercourse is the possibility of cancer of the cervix. Now, the fact is this: if you're taking the combined pill, there's a slightly increased risk of having cervical cancer. By the time a woman has stopped taking the pill for 10 years, that risk has completely disappeared. But it is important, keep track of your periods, report any instances of irregular bleeding, attend your cervical smear appointments, because they are crucial in helping us to identify any early changes that might suggest cervical cancer. The next reason you might experience irregular bleeding from being on the contraceptive pill is by missing your pill doses. We're expected to take the pill at the same time every day. So if you fail to take your pill in the 24-hour period after it was due, you have missed one dose. We can get away with that. But if you happen to miss more than 2 or 3, or if you take one, miss one day or miss a couple of days and then take it, the most likely things that are going to happen are that you lose your contraceptive protection and are more likely to fall pregnant. But in addition, that irregular consumption of the pill means that it disrupts your menstrual cycle and causes irregular bleeding. Next, sexually transmitted infections. Being on the contraceptive pill does not mean that you're protected from a sexually transmitted infection. The effect of different types of infection on the tissues of your cervix or vagina or within the body of the womb is to cause inflammation and irritation. This can lead to different types of vaginal discharge and bleeding that is irregular. So it's important that you always practice safe sex even when you're taking the contraceptive pill. One of the first things that your doctor will do if you report any features of an irregular pattern of bleeding is to check, particularly if you're sexually active, is to check that you do not have a sexually transmitted disease. Next, Pregnancy is a complication of using the birth control pill. We talk about perfect use of the pill and typical use of the pill. If you use the pill perfectly, so you remember to take it at the same time every single day, it doesn't interact with any medication or health condition that you have, then the pill has a pretty decent failure rate of less than 1%. This means that if 1,000 women use this pill, less than 10 of them will fall pregnant. But in real life, what we have is typical use of the pill. And with typical use of the pill, the fail rate increases to about 9%. Again, if 1,000 women were given this pill to use in typical fashion, would expect that 90 of them would fall pregnant while using the pill as best as they can. And if a woman falls pregnant on the pill, different things could happen. Some women could carry on having withdrawal and bleed for the early part of the pregnancy. Some women have irregular bleeding and some women stop bleeding. So for any of these pattern changes, your doctor would also want to do a pregnancy test to make sure this is not why there's a change in the nature of your bleeding pattern. So just before we continue, what has been your experience with the contraceptive pill? I'd really be interested in knowing. Did you experience any of these bleeding side effects, and what were they? What happened when you changed to a different form of contraception? Did it put you off the pill altogether? Drop a line in the comments below. I would love to hear from you. Right, so the other reason a woman might experience irregular bleeding is if she smokes. Yes, smoking is a recognized reason for an irregular bleeding pattern for some women on the pill. Studies show that some women are more likely to experience breakthrough bleeding while they're on the pill than women who do not smoke. Smoking while taking the pill also increases the risk of heart attack and stroke. So it's really important to have that discussion with your doctor to be sure that the combined pill is appropriate for you if you smoke. Another factor that could affect your bleeding pattern while you're on the pill is any other medication that you're taking. The process of absorption of the pill into your blood by your body can be affected by other medicines that you take. Now, very commonly, this can happen with some antibiotics, some medicines used to treat epilepsy or HIV, or even some supplements that we take. Again, something really important to discuss with your doctor, because if these medicines interact with your pill, they can reduce the amount of hormone that is effectively working and increase your chance of pregnancy, but also make your bleeding pattern irregular. And lastly, being unwell with illnesses like diarrhea and vomiting can affect the way your body absorbs the hormones. Again, this means that there is less amount of hormone that is available in your body that can disrupt your bleeding pattern. So if you've just been ill with a stomach bug causing diarrhea and vomiting, then either use extra protection or avoid sexual intercourse. Okay, so these are some of the reasons why a woman might experience irregular bleeding on her oral contraceptive method. So let's just summarize them very quickly. Number one, if your combined pill has a higher dose of estrogen, you are less likely to experience unscheduled bleeding. Number two, if your combined pill or mini pill has a newer generation progestogen, you're more likely to have a better bleeding profile than those progestogens that are older or first generation. Number three, blood levels of these human-made or synthetic hormones can vary up to 10 times more or 10 times less amongst individual women. Number four, changes to the vagina or cervix, things like vaginal dryness, cervical erosion, or even much more significantly, cervical cancer can cause irregular bleeding. Number five, missing your pills. Number six, sexually transmitted infections. Number seven, smoking. Number eight, falling pregnant while on the pill. Number nine, being unwell with something like diarrhea and vomiting. And number 10, drugs that interact with your pill. Okay, so what happens? What should you do if you experience irregular bleeding on your pill? Well, unscheduled or breakthrough bleeding is quite common when you first start taking the pill, usually within the first 3 to 4 months. Therefore, if the bleeding is not severe, if it's not so heavy, if it's not too disruptive, the doctor might encourage you to stick with the method for a couple of months because it does settle down. This is more likely to happen with the combined pill. With the mini pill, on the other hand, you are slightly more likely to experience these irregular bleeding episodes, and they tend to be less likely to settle down if they carry on happening after the third or the fourth month. But despite the fact that we know you could have irregular bleeding that is simply an effect of the pill within these first 2 or 3 months, please speak to your doctor if you have heavy bleeding or severe bleeding, pain in your pelvis or pain along your tummy, as well if you have a fever, if the bleeding lasts for longer than a week in the first instance. If you think you might be pregnant, ensure you speak to your doctor so that we can check the cause of the bleeding and be sure nothing else untoward is going on. Now, if the problem is to do with the pill type or the quantity of hormone with the pill, the solution may be to change the pill to an alternative, or it may be to go into an extended or tailored regimen. This may be a switch from using the 21-day pill to a continuous back-to-back pill, so you don't observe the 7-day break where you take a placebo or iron tablet or inactive form of the pill. Instead, you carry on taking the pill for up to 3 cycles, which can help to reduce the occurrence of abnormal bleeding and some of the other pill side effects. So those are my thoughts on some of the more common causes for irregular bleeding on your regular birth control or contraceptive method. I hope you found the video helpful. Thank you for watching. Make sure you stick around for more explainer videos coming your way. Don't forget to subscribe, like, and click the notification bell. Stay well, and I'll see you again soon.